Stewart.
Thank you, Mr Speaker. My question is to the Minister for Health and Wellbeing. Can the Minister advise my constituents if there is any opportunity to provide the new 4-year medical degree program that is in the Upper Spence Gulf, similar to what's happening in Renmark and also Mount Gambier? With your leave and that of the House, sir, I'll explain a bit further.
Leave is sought. Is leave granted?
Yes, I'm led to believe since the new 4-year program started in Renmark and also Mount Gambier, I'm advised that the programs were overprescribed by participants and they had to turn medical students away, which would result in less graduates being able to train and serve in regional South Australia.
The Minister for Health.
Well, thank you to the member Stewart for his important question. It's a very good question because it's about how we can train more doctors in South Australia, particularly in terms of regional areas. And the member refers to what's a very exciting initiative, which is Flinders University won a competitive program to be able to establish a new regional medical school in South Australia for the first time. This means that students undertaking their degrees to become doctors will not be undertaking that at Bedford Park or in the city, and at the end of it we ask them to go to the regions afterwards, or even doing bits of their degree in the regions, but undertaking the entire degree in regional areas. Now, Flinders University have had a long-standing relationship with the Riverlands and the Limestone Coast areas of the state, and Adelaide University Medical School have had a long-standing relationship with the Upper Spencer Gulf and Eyre Peninsula. And Flinders University, being successful for that, are rolling it out in the areas of the state where they've had those ongoing relationships. Now, it was a very competitive process. Of course, the other medical school in South Australia did try to get access to that program as well. We did punch above our weight in terms of getting more places, I think, by far than our per capita share of that regional medical program. But we are always in the market for more. And the fact referred to in my previous answer, that those capped places from the federal government, we're hoping under a newly elected Albanese federal Labor government will be set to increase. Hopefully that gives the opportunity for South Australian universities to increase the number of doctors that they train here in South Australia. The member refers to the program being oversubscribed. That is the case for every single medical degree program in Australia. They are very competitive to get into. They are capped places, and doctors are medical students are trying to get into these places everywhere around the country. And of course, we are going to need more doctors in the future, both for our needs in the public health system, in GP practices, in private practices. With an ageing population, there will be more doctors needed in the future. And we are increasingly having to do more and more international recruitment because we haven't seen a big increase in those numbers in the past decade. That is about to change. We're hopeful to see those numbers increase. Now, I'm hopeful that both Adelaide University and Flinders University will be able to see their numbers increase into the future. I'll certainly help advocate to the federal government that that should be the place. And I'm hopeful that we'll see an increase in terms of regional medical training into the future as well. Of course, the member's own electorate be very well placed into the future as well because of the investment that we're making in Port Pirie, which the member helped advocate for, which was funded in the last budget, which is to provide that new training facility that we'll be building at Port Pirie adjacent to the hospital, predominantly to help with the training of nurses and allied health professionals, but there's the potential that clinical simulation unit could also be there in the future for use for medical students as well. So we think that there's a great opportunity for more South Australians to become doctors, to increase the number of training places that we have in South Australia. We're very excited about the work that Flinders University have just started in doing so, and we're hopeful that there'll be more into the future. The other component, of course, that I'd add quickly as well is what's the postgraduate training pipeline as well.